Hello, everyone, and welcome back to the Circles Project. My name is Kristen Shermanik, and I'm a respiratory therapist here at the COPD Foundation. Today, we're going to be talking about medication management. When it comes to medications, they are one of the most important pieces of the puzzle for managing your COPD symptoms. Now, there's different ways to use your medications, of course. Some are used every day, that you take them as part of your usual daily routine, and then some are used only when you're having symptoms. It's very important to be able to tell what your medications are used for so that you know you're using them correctly. Some medications don't work quickly, so they need to be used every day and sort of build up in your system before they start working. And others are used for quick relief, right when you're starting to have some trouble. So take a moment and think about some of the medications that you use right now. Do you remember what they're called? Or do you remember what they're for? If you're not sure, it's important to start working on that so we can figure out exactly how to use those medications and get the most benefit for you. So when it comes to medication management, there's a few things we want to do. First, we want to make sure we keep a list handy of all the names of the medications that you take. The dosage, meaning is it, like, for example, if it's an inhaler, you would say, oh, it's 2 puffs twice a day, or it's 1 puff, or whatever it might be. How often you take them. So is it once or twice a day? Is it only when you need it? Is it every day? You want to keep track of those things. So you can actually use the chart in your workbook to help you. You'll see here on page 7 of your workbook that you have a medication chart where you can actually chart very carefully all of those different medications you have, how often you use them, the dose, and then there's an extra section here and it says success. What that means is we want you to ask your healthcare team, either your doctor or your respiratory therapist or anybody on your team, to help you with your inhalers. You want them to watch you use it and practice with it. You want to make sure that you're using it correctly, because a lot of times if we're not using our medications exactly right and not having perfect technique for that inhaler, you're not going to get the medication to the spot that it needs to be in. If we're using our inhalers incorrectly, maybe we're not taking a big enough breath, or maybe we're not holding our breath long enough, the medication isn't going where it needs to in order to make you feel better. So we want to make sure we're keeping an eye on that. So here you're going to, track your medications and then have your healthcare team check you off in that success area to say that, yes, you've mastered the skill, you know how to use it, and you're going to want to practice that every so often. I would say check back, every few months to make sure that you're still using it correctly, because sometimes we kind of forget about it or get a little sloppy over time. Some other things to think about when it comes to medications is that not every inhaler works the same way. There's so many different inhalers on the market right now. Some look like this picture here, which are metered dose inhalers. Those are the inhalers that some patients call puffers, where you press the canister and a puff comes out. That's one kind of inhaler. There's also dry powder inhalers, which come in a variety of shapes and sizes. Some look like discs, almost like a frisbee. Others look sort of like a bullet shape that are tall. Some are little egg-shaped ones that are small. Some have pills you put inside and puncture. So there's many, many, many different kinds. And now you can kind of see where the confusion comes in for some people with COPD, because there's just so many inhalers and different ways to use them. They're all a little bit different. So it's very important to, read through those instructions that come in the package, even though I know some of us just don't like doing that. But sometimes you have to, because you just don't know, the differences between one inhaler and another. It's very hard to keep them straight. So you're going to definitely want to do that. The third type of inhaler is a soft mist inhaler. Now, those are a fairly new type of inhaler. They are a little bit different than the previous two kinds. Those are, they actually release medication in a soft mist, just like it says in the name. And those require a very slow, deep breath in to make sure you get all that medication. Now, dry powder inhalers, the first ones we talked about, those require a fast, deep breath. Because if you want to think about it this way, the metered dose inhalers, or the puffers, they puff out a dose. They spray it out very quickly. The dry powder inhalers don't release anything until you breathe it in. So you're doing the work of inhaling the medicine. That's the best way to think about it. So if it's a powder inhaler, you have to do the work. So you're going to have to breathe quickly and deeply and really suck it in to get that medication into your lungs nice and deep where it needs to go. The metered dose inhalers have that quick puff, But the thing to remember here is that sometimes you actually need a spacer for those inhalers. And we'll talk about those in just a little bit. You can always ask your doctor or healthcare provider to make sure that you're using it correctly. And then again, the soft mist inhalers require a slow, deep breath. Now, if you're not sure what kind of inhaler you have, you can do it two different ways. You can either talk to your healthcare team and just ask them, which one is it? How do I use it? You can also, if you need a little bit of a reminder, you can watch our inhaler and nebulizer videos. We have a whole selection of different videos for you to watch that show you exactly how to use each type of inhaler. So the place you want to go is right here at the very bottom of our list. It's https:// ooh, that's a mouthful, copdf.co/videos. That's where you want to go. So jot that down and you can see some videos there, and you can also see it in our Pocket Consultant Guide app, which we'll talk about a little bit later. So when it comes to our video series, this is what the website looks like that you're going to. Now, there are so many different inhaler and nebulizer videos on here. It covers just about every major type of inhaler that's on the market today. So for example, here on the first page, you see just an introduction to inhalers. And you can see in the picture there that we have all different kinds. On the left, you see some dry powder inhalers. There's also some in the center. And then on the right side, you see a spacer, the tall thing sticking up on the very far right. And there's also some meter dose inhalers laying down next to it. So the holding chamber or spacer is something you're going to want to think about and ask your healthcare team about. What that does is it holds the puff and allows you to breathe it in slowly rather than sort of racing to catch that puff that the meter dose inhaler releases, because remember, it releases it very quickly. So you may need to use a spacer to really get the maximum benefit out of that inhaler. But that's something you can talk with your healthcare team about. So here's our first page. Here's an example. We have our discus inhaler towards the bottom. That's one of the dry powder inhalers. And then if we keep scrolling down, we'll see there's even more. There's an Ellipta inhaler, a Flexhaler, a Handihaler. There are so many different kinds. As we move down even further, we'll see there's different ways to take your MDI or meter dose inhaler. You can do it with a closed mouth, which doesn't sound quite right, but I promise you it does work. There's a certain way to do it, so you can watch it in the video. There's also an MDI with the spacer, like we talked about just a few minutes ago, using that holding chamber to keep that puff suspended for you and kind of slow down the process. And then there's other inhalers here too. There's many, many different kinds. And as you scroll down further, you'll find nebulizer videos, videos on using your nebulizer, but also on how to clean it, how to take care of it. And those are really important pieces of the puzzle too. The other place you can find our videos, they're identical videos, so you can watch them either here or on our website. But if you'd like to see it in the Pocket Consultant Guide app, you can find it here. This is available for download for free. It's absolutely free at the App Store for Apple or for Google Play. So those are the two different places you can find it, and it's a free download. You can watch inhaler videos, and you can also keep track of medications and exacerbations, activity. You can have a calendar of, tracking your symptoms. So it's really a nice all-purpose app. So if you have any further questions about your inhalers or your medications, be sure to talk with your healthcare team. That's what they're there for. It's also, the information is also listed in your workbook. So you'll have a whole section there that gives you a lot of information. And then of course you have our app or our website. And then here's another website that you can go to that's part of our website that will give you different tools to help manage your condition. So this could be things like a MyCOPD action plan or a tips sheet to give you ideas on how to live well with COPD. This is where you're going to want to go to get some free materials. Okay, well, thank you very much.